go over with you is how to assist with a urinal. So when you're assisting with a urinal, start by getting a report at the beginning of your shift. Ask your nurse about your resident's needs, abilities, and limitations. Knock on the door, request permission before entering. Call them by the name they prefer. Identify yourself by name and title. Explain what you're going to do. Find and gather your supplies. So for urinal, I've got my urinal, towel washcloth, and some gloves. I'm going to provide for privacy by closing the curtain drapes and doors. I'm going to wash my hands, wear gloves for body fluids, and use good biomechanics. So to assist with a urinal, raise the head of the bed. We want to put pressure on the bladder to make sure they're able to empty it completely. Put on your gloves. We can just offer them the urinal. If you have to place it, it lies flat this way, penis goes in the hole, handle goes up. This, make sure the penis goes in the opening. Cover them up, give them the call light, give them the toilet tissue, step out, return when called. Remove the urinal. You're going to take this into the bathroom and again checking COCA. Color, odor, characteristics, and amount. Now on the urinal, we do have different measurements, and it's probably going to be a little hard to see on the tape, but I'm sure you're going to do it in lab and in your clinical setting. But you'll notice there's ounces on one side and cc's on the other. We're always measuring in cc's, which is cubic centimeters. So your outputs are going to be in the hundreds. 100, 200, 300, 425, 550, and so on. If you say your output is 6, 8, or 10, you're looking at the wrong side. You're looking at the ounces. When you're looking at the urinal, when you're doing the measurements, each 100 is labeled. Then there are 3 lines in between. Those are 25 cc's per line. So it starts at 100, the next is 125, then 150, 175, 200. 225, 250, 275, 300, all the way up to 1,000. So just measure how much is there. If there's anything wrong, leave it for the nurse to check after you check color, odor, character, and amount. And if everything's okay, rinse it, sanitize it, and return it according to facility policy. Put it away. Take off your gloves. Wash your hands. Assist them to wash their hands. Wash your hands again, and then your final steps. A, check alignment, make sure they're comfortable. B, make sure your bed's in the lowest position. C, make sure they have their call light and water. D, ask them if there's anything else they need. And E, say thank you. Everybody deserves that. F and G, find and gather your supplies, clean them to company or facility policy. H, ask how they want those hanging curtains, open or closed. And then eye your way out the door. I'm going to wash my hands, I'm going to do a visual safety check, report unusual findings to my nurse, and document. Thanks for watching.